we will be discussing about the fundamental positions. There are 5 starting fundamental positions. So before discussing the starting fundamental positions, first we will be discuss about the posture. So posture, it usually follows the movement like a shadow, and every movement it begins in a posture and it ends in a posture. So this was written by the Sherrington, that the posture it usually follows the movement like a shadow. So now we'll be talking about what is the starting position. So any posture from which movement is initiated, which may be active or passive in character, is called a starting position. And in exercise therapy, we have 5 basic starting positions: standing, kneeling, sitting, lying, hanging. So all other positions, they are derived from them, from the starting positions. And in this position, equilibrium and stability is maintained by balance of forces acting on the body. So the muscular force which is used in the starting position is isometric. That is, there is no change in the length of the muscle, but there is increase or in the tone of the muscle. So the strength and distribution of this contraction, it is controlled by a series of reflexes which are known as postural reflexes. So starting with the fundamental position, first is standing. So this is the most difficult fundamental position to maintain, because body it must be balanced and stabilized on a small base by the coordinated work of many muscle groups. Now the position is that the heels, they will be together in same line. The toes will be slightly apart. The knees are together and straight. The hips, they are extended and slightly laterally rotated. The pelvis, they are balanced on the femoral heads. Spine, it is stretched to the maximum length. And vertex, it is usually thrust upwards. Ears are leveled and the eyes, they are always looking straight forward. The shoulders, they should be down and back, and the arms should be hanging loosely to the sides. And the palms, they will be facing inwards towards the body. So this is the basic fundamental position of standing. Now the muscle work used in standing position. The muscle work required to maintain this position, it could be vary with the circumstances, but the reduction when it reduces, the muscle work reduces when the body segment is in good alignment and is perfectly balanced. But the muscle work, it increased by the faulty alignment and by the external forces that disturbs the equilibrium. To hold this position, anti-gravity muscles of the trunk and the lower limb, they work isometrically. So these are the various muscles which are used to maintain the position of standing. So intrinsic muscles of feet, they stabilizes the feet, they prevents toe curling. The plantar flexors, they balances the lower leg on foot. The dorsiflexors, they counterbalances the action of the plantar flexors. They support the medial longitudinal arch of foot. The everters, they counterbalances the action of inverters, and they presses the ball of great toe on ground. The knee extensors, they slightly work, and the hip extensor, they maintain the hip extension. They balance the pelvis on the femoral heads, and the hip lateral rotators, they have a slight action by bracing of the legs and foot arches. The spine extensors, they keep the trunk upright. The lumbar flexors, mostly the abdominals, they prevent the overaction of the lumbar extensors. They maintain the correct angle of the pelvic tilt, and they also support the abdominal viscera. The prevertebral neck muscles, they control the extensive neck extension, straightens the cervical spine, and the flexor extensors of atlanto-occipital joint, they works reciprocally to balance the head. The elevators of mandible, they closes the mouth, and the scapular retractors, they draw the scapulae backwards, that is the glenoid cavity, it faces laterally. And the arms, they are in a relaxed position. So this is a good posture when a person is standing. So the ear hole lines up with the center of the shoulder, chin should be parallel to the floor. The thumbs, they face forward, and the shoulder should be aligned with hips. Hips should be aligned with the ankles, and the weight is distributed evenly in both feet. So ears should be at even level, shoulders should be at even level, and the hips should be at the even level. This is a good posture when we are in a standing position. Now these are the few examples of poor posture also. If somebody have a forward head posture, flat back, that is a poor posture. Then rounded shoulders, or someone have a weak abdominal muscles, that can also lead to a poor posture. So if there is a poor posture, there will be more utilization of the muscle work, and more effort of the body will be required to maintain that posture. Now effects and uses. So it usually have a very relatively small base of support. The center of gravity is high. The state of equilibrium, it is less stable comparative to the other fundamental positions. Standing is a less stable position, but it is suitable for exercises for those who can maintain it correctly. Attaining and holding the standing posture, it usually reduces the fatigue, and it also conditions the postural reflexes. It is usually a position of alertness, and thorax is free, abdominal viscera is well supported, and also sometimes this position is associated with feeling of joy and efficiency. Now talking about the derived positions. So when the positions of arm, leg, or trunk is altered in the fundamental position to modify the effective position or to start the exercise. So basic, the purpose is to increase or decrease the size and stability of the base. We can raise or lower the center of gravity. We can ensure the maximum local or general relaxation, to control or fix the particular part of the body to have a localized movement, and also to increase or decrease the muscle work, to increase or decrease the leverage, and to provide the convenient position to start the exercises. So these are basically the derived position from standing position. So if we alter the arms, this is wing standing, bend standing, reach standing, yard standing. And if we alter the lower limbs, there will be stride standing, toe standing, walk standing. So talking about some clinical applications, some exercises. So we can go for lateral deltoid raise. So stand in an upright position with the dumbbell in each hand, and the palms will be facing in towards your sides. So we slowly raise the arms out by the side, maintaining a small bend in the elbow, and we bring the arms up till they are parallel with the ground, and pause at the top, and then we repeat as we desire the effect. So this is a lateral deltoid raise. Walking exercises. So walking is very effective exercise for people of all age groups, and it is at least 20 minutes is essential to relax our body muscles and provide our mind good recreation from our stressful daily routines. Now this is a standing shin stretch. This is also a clinical application. So we can prepare by standing and touch the wall or stationary object for balance. Then grasp the forefoot behind, and we pull the forefoot to the lower back. So we hold the stretch, and we repeat with the opposite side. So various muscles, mostly the muscle target are the tibialis anterior or sometimes the quadriceps. This was all about the fundamental position, standing. In next video, we'll be discussing about the other uh, fundamental positions like kneeling, sitting, lying, and hanging. Thank you.